I think the sense a lot of people have is both panic about getting vaccine and then feeling ripped off when they see that they're either on the edge of these communities that are getting these hotspot clinics, or that they work in them or they go through them, and that they're feeling ripped off and they're feeling like they're getting left out with this age-based program. So I wonder if you can just talk to that panicky feeling and the anxiety a lot of people are feeling.
I know, and it's really tough right now as we see case rates being very high. We see people in hospital, and we want to do our part to be protected ourselves, but also I know that to protect our families, the people we're closest to. And it has been incredibly challenging to stand here and know that, we only have a limited amount, and how can we get it to people in the most efficient way. But I can be reassured, the things that we need to do are the things that will protect us in the meantime. And we need to keep doing those. And we have seen great success where we've had communities vaccinated. If we look at First Nations communities around the province where we've had a whole of community approach, many of the small communities where it didn't make sense to go in multiple times, we've had great success in a number of our high-risk industries where we have focused on our temporary farm workers, making sure they're protected so that they can do those essential work. The fact that we've been able to immunize all of the large food processing plants in the province, those are real successes. And sometimes it seems like it's all over the place and it's everybody but us. But each person, each community, each business where we are able to protect people that way is good for all of us. But it is taking longer than we would like, where we have clinics that are ramped up and ready to go as we're receiving more and more vaccine in the coming weeks. So your turn will come, and I think we all need to just take a deep breath and know that there is vaccine for us, and it will be coming, and we will get it, and we need to celebrate for every single person who's immunized, because all of us collectively will get there in the next few weeks.
Lisa, do you have a follow-up?
One of the other things people are wondering, they were anxious waiting to see their 58-year-old group called, why can you not set a new schedule saying it's 58 today, it'll be 57 on such and such a day, and then going from there?
Yeah, that's what we will be able to do once we get everybody in the registration, because then we know the exact numbers. So it's challenging. It will be more like that as more vaccine becomes available. It has been a balancing act of vaccine coming in, and we've been down to less than 10,000 doses in the entire province on a Monday afternoon. So it is really trying to titrate as much as we can. And the best thing that we can do to make that easier and be able to forecast a little better is for people to be registered. So you're in our system, and we know we can contact you as soon as we get those vaccines in those clinics. And so it's not a simple thing, and to try and distribute vaccine to the many clinics around the province and know exactly who's going to be where when and how much is going to come in when. And we've been trying to do it without canceling clinics, because we know how discouraging, talking about feelings of disappointment and anger and frustration if clinics are cancelled, and trying to get as much out as fast as we can. So I believe that we are going to be in a different space, hopefully when the Pfizer starts arriving on Monday, where we will have enough vaccine to really accelerate those clinics. So everybody, go right now, go talk to your friend, help them, register right now with our vaccination. What's it called? With the vaccination registration. Get vaccinated, I'm sorry. And that's talk about confusion. So right now, go get registered, and as things speed up in the next few weeks, it will go down in age very quickly. Yeah.
And just to add to that, it was 58 last night, but we can register anytime. It's really important that people because it's going to come much more quickly in the next couple of weeks, year by year by year, as you suggest, Lisa, and so it's really important now that people be registered. If you're 58 and above and you haven't registered yet, you're going to register and then be able to book right away if you're in that category. But if you're if you're anything below 58, this is the time to register, because then you can book your appointment at the first possible moment. You'll be contacted by the immunization team, either by text or by phone or other means, and you'll be able to book your appointment right away. And it's very, very important that people register. I just wanted to say, with respect to the overall program, over 70, we targeted people on an age basis. Over 70, more than 83% of people immunized over 70, which shows the effectiveness of that. 188,000 people clinically vulnerable, immunized, because we wanted to focus on a group of people who was clearly more vulnerable to COVID-19. 205 First Nations communities immunized across BC. And many, and especially local and rural health areas, which are farther away from acute care, have been immunized at a greater rate than others. We have 25 local health areas that have been immunized at more than 50% of the eligible population for their first dose. 25. Those are disproportionately in rural areas, and that is for good reason. And so all of that shows that the targeting that's taken place, long-term care, assisted living, older population, clinically vulnerable, rural and remote communities, has been effective in the vaccination campaign. And we'll be providing some detailed information next week by local health areas that we'll be able to update, so you'll be able to see. And there hasn't been significant variation as between local health areas. There are the rural and remote ones, and those with a larger Indigenous population that are a higher overall level. But across the system, there are only now under 30% vaccinated. Only 4 local health areas in the entire province under 30%, and so the variation between health authorities is not that great, which means everyone is getting access everywhere. There's some differences between rural and urban and between health authorities in the specific strategies that have been used. And I'll just talk about one finally. In Windermere last week, if you recall the chart, the local health area of Windermere, or in Columbia Valley, was the highest level in interior health today, because of a different approach, but similar approach to what has been happening in the Fraser Health Authority. Over 50% of people in Windermere have been immunized, as is in Revelstoke, as in Prince Rupert, as of course you all know in Whistler.